Hello, good evening. So, welcome back. Now, see, today we'll be starting. Yes, thank you so much. Now, from today, we'll be starting a lower limb. What I was thinking, let's see, there is one method, the way we go as per the Choracea or as per the Grays, that is, these are the muscles, these are the bones, right? That way. Or the other way of learning anatomy would be we go by the functional way. Functional way would be so interesting because it is like as if you are learning orthopedics parallelly. Yeah, actually it would be like that. And in that we can keep on adding even some more topics. Yeah, I'm good. I'm good. Yes. You'll be getting all the PDFs for whatever all the lectures, whatever we'll be discussing, whatever I'll be writing. You don't have to take any notes, right? Like all the previous sessions, I'll be putting these PDF immediately after our session, and they are on cloud, so anytime you can just access it. So don't worry, right? Yes. Good evening. Yeah. Now no more breaks. That's right. Okay. So what I was talking about is that this time we'll understand the entire lower limb with respect to its joint. Say for example, today we'll be taking the overview. Right now in this, you'll be astonished that you'll be learning so much in just one single session. There'll be so much. Now it's completely fine that if you don't remember all the muscles or you don't remember all the say small points in the bones, it is completely fine. No problems. It is just for that those words should be familiar to you. Once they are familiar, then when we'll be actually going from tomorrow, when we'll be actually going deep into the content, you'll really relish it, right? So how we'll be doing? Say in the entire lower limb, there are only three major joints. One is the hip joint, second is the knee joint, and third is the ankle joint. How nice would it be if we really know that, say, for the hip joint, which are the muscles which are going for all the movements of the hip joint, right? Then we'll see those specific muscles, their supply, blood supply, nerve supply, everything, so that everything around the hip joint is full and complete. Now, in case if you are studying, if you let's say you are in third year and you are studying total hip replacement, immediately you will know that which are the muscles to be cut, and the concept would be very clean. Otherwise, what really happens that once you learn front of the thigh, then back of the thigh will come after some time, right? Gluteal region is considered as if it is a separate entity. No, over here we'll be learning everything in such a compiled way that when we'll complete the hip joint, you'll be very pleased with yourself that yes, hip joint is done, right? From its functional aspect. Then we'll be going for knee joint, then we'll be going for ankle joint, and yes, ankle joint is where that foot will come, right? So there'll be so many bones, it would be pretty complex. So over there, not only the say hip joint or knee joint or ankle joint, we'll also be learning the mechanics of it. That is how exactly that joint would work, right? Okay, thank you so much. See, I always, I am back simply because of you guys, right? I used to read all the mails, right? Unfortunately, couldn't reply. Still, so many mails are pending, but I'm trying to reply slowly and gradually. So that's how we'll go for it, right? So let's start. So here is, I've given the name lower limb, the first step, right? First step. Literally, it would be like a first step. So let's say here, right? Completely focused to the lower limb. Now in lower limb, this much is what we'll be watching, right? So one thing that this is like hip bone, right? Hip bone. But there is another name of it, right? Because this is such an odd name, so they really couldn't give any name to it, right? So actually it has got no name, and that's why it's called as the innominate bone, right? A bone whose name cannot be given. Innominate bone, because it is an irregular bone. So that gives us the speciality of it. This is an irregular bone. Hip bone is combination of three bones, right? It's a combination of, don't worry, we'll be even watching the zoomed version. We'll be watching this in complete detail also, but just an overview, right? This is a combination of ilium, right? Take care of the spelling, ILIUM, because ILEUM is what is small intestine, right? Duodenum, jejunum, ileum. So that third part is ileum, right? So this is small intestine. Small intestine. So just do take care of the spelling part, right? It is ileum, ILIUM. Then this portion, right? This portion. That's the portion on which everyone sits. So this is what is called as the ischium. It is quite musical. Ilium, ischium, and the pubis. Pubis is, this is something which is in center. So that is pubis. Combination of all these three bones, that is what gives hip bone. Now this hip bone, right, let's zoom it a bit. Yeah. This one is sacrum, right? We'll be watching all the parts of the sacrum also, because that is also, say, it will come into pelvis also, it will come over here also. Now on top of it, what do we get? We get all those lumbar vertebra, right? So how many they are? They are 5, right? So we do have, that one would be, we calculate ulta so that we don't commit mistake. So L5, L4, L3, L2, and L1, right? So after that, this would be obviously thoracic. So that would be T12. Okay. So we have ilium, ischium, pubis, sacrum, L1 to L5, and T2. Okay, gentlemen. Now the thing is, say I appreciate, right? But when we are going for the explanation, it is okay. Means if you want to type, you can. Well, that's very good. You topped in your college. Congratulations, right? But now let's focus, right? Let's focus on this. So done, right? So vertebra's done. Innominate bone done. This one is femur, correct? Long bone, 18 inches bone, quite a long bone, right? And a very powerful bone. And then we have got two bones over here, that is tibia and fibula. Now, see, those who are seniors, they might feel that this is so primitive. Yes, I agree to that. This is very primitive. But I am taking it into consideration that someone who is in absolutely first year and actually he has not even heard about femur, right? So that's how I am taking. Just within next 5 minutes, you will start feeling the depth. So this is what is called as the patella, right? Patella or the kneecap. True? Kneecap. Then over here, these are all tarsals, right? Tarsals. The way in the hand there were carpals, metacarpals. So same way over here, these are the tarsals and metatarsals. And trust me, we'll be learning these tarsals, metatarsals, and the muscles which are attached, and all the attachments, right? We'll be studying it in quite a depth, because there are so many things associated with the foot, right? And then obviously these are the phalanges, and we will be having this big toe. And this big toe, the way thumb was called as pollicis, this is called as helix, right? This is called as helix. So that's it. These are the bones which will be which will be dealing with. Very nice. All right, all right. That's why I'm taking it in as much basic as possible. Okay, right. So these are the bones. Now let's see things in say here is another figure, right? Another image. Now in this image, if you see, you should be able to identify and see the things with much clarity, right? Say if I don't mark anything, you should be able to see that which is L5, L4, L3, L2. You should be able to see sacrum. You should be able to see ilium, ischium, and pubis. Say this is pubis, right? That is pubis, right? This is ischium. As I said, that it is the ischium on which we sit, and this is ilium, right? Ilium, ischium, and pubis. Now, guys, I tell you one very interesting thing. You know, so sometimes though we are like discussing it in open, but it is a fact. It is a fact. Lower limb or the legs, you know, they are considered as one of the most important part of the body for your personality. Yeah, that's true. It is one of the most important, male or female, right? You got my meaning. But yes, it is so important. It is so important because what really happens is then when guys they go to gym, right? They keep on doing all those matlab making the biceps and triceps and pectoralis major everything, right? But the legs they are like chicken legs, right? They are really weak. So this is vital, especially when you'll be on stage, right? When thousand eyes are watching you, you'll feel the difference. You'll feel the difference, right? So your legs should be very powerful, and that's the reason as I'll be explaining you all the muscles, right? I'll keep on telling you some of the very important exercises also. This is true. This is true for yeah, we'll be talking about COVID at a later stage, but definitely we'll talk about. Yeah. So what I was telling that I'll keep on telling you some of the very important exercises. Again, those exercises they won't be taking your 5 to 7 or at the most 10 minutes. But see, at times when I see that medicos, they are physically not strong, so I feel very bad. Because see, you are learning so much. You know every muscle, right? You know their functions. So then why not? Why not to utilize that knowledge? And still one very important thing. In case of females also, right? In case of yes, every female. That what's the problem in looking good, right? In case of females, yes, it is considered that the sensuality of legs that is far more as compared to any part of the body. Yeah, that's true. So that's the reason that whether you are a male or you are a female, this region is vital, right? It is vital, and I'll tell you some of the exercises also, and they are pleasure. Means they won't take your 5 to 7 minutes, but you'll like it. Another important point is something which people don't discuss, right? They feel, "Kare, how can we really talk about it?" Well, why not, right? Say, especially when we'll be discussing in abdomen, that is in the pelvis, right? Yes, male and female reproductive organs and everything is to be discussed, right? It's part of our anatomy. But at the same time, those intimate events, those intimate moments, they include some of the vital muscles of the lower limb. And yes, we'll be talking about it. Because actually, it happens like as the life progresses, after some time, suddenly there is so much of boredom, right? Why it should happen? It means your partner, suddenly you will start feeling that okay, he or she is not that interesting. Now, there has been lots and lots of research done on this. Unfortunately, people don't discuss, right? But it is so important. And many time it happens like my students, right, to whom I must have taught in say 2000, right, and then they meet and then they say कि sir जो 20 साल पहले आपने बोला था today also it is so true. And yes, it is true. It is true. When I used to teach in BJ Medical College, so many students they somehow meet, they come in contact. So that's the reason. Say lower limb. I always say it is very important, more important than when we'll be studying the pelvis. Pelvis, so yes, it is part of it. So definitely we'll be studying it in more detail. But over here, I'll be telling you certain things which are either not mentioned in the books, they will not be asked in the exam, they will not be asked in any of the interview, but they will be playing a major role in your life, right? So, and I'll write it down, right? I don't have any problem. So I'll even write it down. Okay. All right. I know. I don't have any problem. It's not like that only leg workout increases testosterone. Yeah, we'll talk about it. We'll talk about. Otherwise, we'll deviate from that from the topic. You know. Okay. So where were we? Huh. Over here. So let's talk about say this in bit more detail. Right. Now this is a zoom picture, and say this is easy. Right. So from L5, L4, L3, and L2, right? All those things are good. Now, in case of sacrum, this entire portion is sacrum. I'll draw and then I'll remove it, right, for the clarity. Say this much is sacrum, correct? That much is sacrum. I now just remove it because we'll be learning parts of sacrum. So one thing is very, very simple and easy that this one, just let's see which color is better. Just a minute, just a minute. Okay, okay, yes, that's better. That's better. So over here, these are the two parts. This is the medial part, right? And that's the lateral part. And again, they are parts of the sacrum, right? Now for the bone, the most complex bone. I am interested in this portion, this one. That is what is called as the Ella of Ilium. Ella of Ilium. This portion, right, we are very much interested. Why? Because there'll be one very important muscle which will be arising from this. And this muscle, when it will be merging with another muscle, and those two muscles, they will be crossing the hip joint and they'll be landing on the femur. Yes. And that muscle is something which we really want to utilize in our exercise, right? So over here, this is body of ilium, right? Guys, just a minute, just a minute. I think there is some bandwidth issue. Suddenly it has, just a minute. Please hold on. Yeah, sorry. There was some bandwidth issue. Now it's settled. Now I have settled it. So no problems. Okay. Yes, yes, yes. I'm back. I'm back. There was a bandwidth issue, and before it could really say disturb the session, I just settled it. That's why there was a break for 2-3 minutes. I just had to switch from one bandwidth provider to second bandwidth because there was some problem going on. Anyway, now everything fine. So here it is, the body of ilium, right? So we said ilium, ischium, and pubis, right? So over here, this is ella of ilium, or the wings. That's right. You can even say wings also, but that will be where the iliacus would be connected. Iliacus, and then it will be connected with psoas. So psoas, iliopsoas muscle. So this muscle, there will be one muscle like this. There will be psoas over here, and then that will be forming iliopsoas. Right? We'll see this muscle. Yeah. Okay. And this one, that is pubis, correct? That is pubis, but it is called as body of pubis. So this is pubis body. The extension is always called as the ramus. Ramus means branch, right? Ramus means branch. So over here, this is inferior ramus of pubis. And this inferior ramus of pubis will be meeting the ramus of ischium. So see, here is the ischium, right? Here is the ischium. And this time we'll call it body of ischium, right? The way it was the body of pubis. So this is body of ischium, right? And it is this body of ischium, and over here, very right, that would be ramus of ischium, correct? So that's how the things are defined. That there is pubis body, there is ischial body, and their both ramus will meet, right? So this would be important when you'll be, say, defining that where which muscles are connected, right? So that's why this clarity is very much needed. So once we know these landmarks, and then when we'll start describing, it will become so easy, right? Now see, if we always say that if there is inferior ramus, there has to be superior ramus. Otherwise, they would have called it ramus of pubis, right? So logically, that's the only portion which is left out. So that would be very right. Superior ramus of pubis. Okay? So that portion is done. Now we move on to the femur part, right? So in femur, ramus means branch. Ramus, right? Ramus. Whenever you say ramus, you can say branch or extension, right? Okay. So over here, that one is easy. It is head. So if that is head, so we call this thing as neck, right? No marks for head, neck, everything. But there is one very interesting thing. There is one prominence, this prominence, and there is another one, a small prominence. And this is what is called as the trochanter. So this is greater trochanter, greater trochanter, and this one would be lesser trochanter, lesser trochanter. Let me write something over over here. Here is the space. See, greater trochanter and lesser trochanter, right? So in between, from greater trochanter to lesser trochanter, if anything is going, so we'll call it intertrochanteric and intertrochanteric. That is between trochanter. That is intertrochanteric. Now this is the point where people fumble. there are two things. There is intertrochanteric line and there is intertrochanteric crest. Line is thin, crest is very prominent, right? So this line is in anterior and this crest is posterior. Simple as that. Don't forget this thing, right? Don't forget this thing. This is very important. So immediately your confidence level would be very high when the question is asked that this is greater trochanter, this is lesser trochanter. So what is this? And we'll say this is intertrochanteric line because this is anterior. So how would that intertrochanteric crest would look like? Yes, so that's what our brain would think, that now as we'll see the posterior part, we'll see that how prominent it is. And when the things are prominent, that means powerful muscles would be connected to it. True? And obviously the back muscles, that is the hip muscles, they are much more powerful. True? So that is intertrochanteric line. I'm not writing, right? Or let me just write, I'm just writing line. So you will understand. Correct? Okay. Let's see it in one more way. All the vertebrae you will be able to tell, right? Now, the sacrum, right? This sacrum, this is base of the sacrum. Now, this is from the functional point of view, right? This is base of sacrum because it is the base of sacrum which is actually bearing the load, right, of the entire body. That is the base of the sacrum. Now, this one, this is sacroiliac joint, right? So, because this is the ilium, this is sacrum, so that is the sacroiliac joint. And what the border which we are watching, this red color, so that would be like a medial border, correct? It will be the medial border of ilium. Okay. So now we need to know two things. One, iliac crest, iliac fossa, and so just do your hand like this, right? Your hand like this and put it into your waist, put it on your waist. Yes, obturator, foramen, everything would come. So you don't jump, right? Let it come step by step. But take like this. This is your hand, right? Put it into your waist as if you are standing like this in style, right? So this entire portion, right? This entire portion, that is the iliac crest. That is the iliac crest. Okay. So here is what is called as the iliac crest. Now this iliac crest, it has got all those, say, inner, outer, intermediate margins. Yes, it would come. Over here, this is fossa. This is iliac fossa. That means it would be a depression. So it is in this depression that big muscle would be connected, right? Then rest of the things you are already knowing. This is body of ischium. This is ramus of ischium, right? This one. This is inferior ramus of pubis. This is body of pubis, and that one is superior ramus of pubis. I think it's fine if I don't write this, right? You already know it. Okay. All right. Then see over here. This is clearly, it can be seen, this is intertrochanteric line because it is anterior, right? So here is the greater trochanter and this one is the lesser trochanter. So that makes our life quite easy. Now on the front surface, this is anterior surface. It has to be, right? Because we are watching it from anteriorly. So when it is anterior, these lines, they are indicating the borders, right? So these lines, they are indicating the border. So how easy it could be that we just say this thing as a lateral border, and we call this as the medial border. Easy, right? Medial border. Now, if you see, We are just focusing on that portion which is related to hip, right? We'll be following the same practice every time as we'll be approaching the joints. Okay? That's how we'll be going for that. Now, say once you have defined lateral border and the medial border, after lateral border, there would be lateral surface. So we can always say that this one would be the lateral surface. See, as such, we wrote so much, but things are not that complicated, right? It is base of sacrum, medial border of ilium. It is fine. This is iliac crest. Remember, like this, right? Then iliac fossa. That is the fossa in which the muscle, big muscle, iliacus would be connected. And then we have got greater trochanter, lesser trochanter. In between is line. Line is anterior. Do remember. So only the keyword which is to be remembered in this entire thing, because rest of the things are quite self-explanatory, right? So we'll say that this line, intertrochanteric line, is anterior. It is anterior, right? And say lateral surface, and rest is all quite easy. Okay. Now we look at it from those points. Yeah. From those points which are vital when we'll be defining the muscle attachment. So you have learnt iliac crest. So then the fingertip, right? If you have really put it on your waist, when you try to think that this fingertip is where, you'll feel a prominence. And friends, that prominence is anterior superior iliac spine. Anterior superior iliac spine, right? So that one would be iliac crest. Iliac crest. And actually, I'm telling, right now, just put your hand on your waist and feel that, right? So that you'll never forget. So anterior superior iliac spine, that is the tip over here. If there is anterior superior iliac spine, so there has to be anterior inferior iliac spine also. Otherwise, they would have called it anterior iliac spine. So you must have guessed. That's right. This one. That is anterior inferior iliac spine, right? That is anterior inferior iliac spine. So it means anterior superior and anterior inferior. So will there be something like posterior iliac spine? Yes, it has to be. Otherwise, they would have called it just superior iliac spine and inferior iliac spine. So we do expect that there would be something like posterior, right? Let's see if it comes. Okay. This one. This is the junction between ilia and the pubis, right? This is the region of pubis, right? This is like pubis, and from here it is iliac. So this is a prominence. This is a prominence, and that's why it is called as the ilio. Let's write it here. Yeah. Ilio-pubic eminence. Prominence is very big. So eminence is chota bhai of prominence, right? So that's why this is ilio-pubic eminence. And this one is pubic tubercle. Pubic tubercle, right? It is just a small projection. So that's why it is just tubercle, right? This line, this one, right? That curved one, that is what is called as the arcuate line, arc-like, right? So it is called as the arcuate line of ilium. That's right. It is arcuate line of ilium. And finally, the base, which was called base, it is also called as the wing. It is also called as the ala of sacrum, right? Ala of sacrum. See, gradually we learned the parts of the bones. Now when we, and I really say insist, okay, and this one is obturator foramen. Obturator foramen. Right? Now this obturator foramen would be obliterated, right? There'll be muscles, but there'll be one muscle which will be from inside, there'll be one muscle which will be from outside, right? So that's how we'll see it in more detail, right? All good? Let's move on to the next one over here. Now see, this looks bit crazy. You know? This is where we see all the muscular attachments. Will not be watching all the muscles because there is no point, right? You'll keep on imagining that from where this muscle is coming and going. So what we'll do is I'll give you 5 muscles first, then gradually we'll keep on adding one after the another, right? And then there are few muscles which are so interesting that you'll never ever forget. Okay, so first one we pick up from that iliac fossa, and its name itself is Iliacus. So this is Iliacus, right? Good one. This is Iliacus. Now this Iliacus, it is a big muscle which will be going down, right? Now in thigh, we'll come across a muscle, right, which has got 4 parts. So that's why it would be called as the quadriceps. Quadriceps. Why quadriceps? Quad means 4, ceps means head. It means it has got 4 heads. Now this quadriceps, this muscle, where is it? It is into the region of thigh. So anything if it is in the region of thigh, so it is called as the femoris. So quadriceps femoris, right? So this quadriceps femoris, right, when it has got 4 heads, so which 4 heads? There are 3 muscles which are vast. Vast means they are big, they are very big, huge muscles. And then there is one muscle which is straight. Which is straight, right? So these, anything which is straight, we know it is called as rectus. So we'll call it rectus, rectus femoris. Right? Now luckily for this big muscles, they have made our life very easy, right? There is one muscle on the lateral side, there is one muscle on the medial side, and there is one muscle which is in the center. And that's the reason they are named like this, that is lateral. So we call it lovingly lateralis. This is medial, so we lovingly call it medialis, right? Medialis. And intermedius, well, not much love for it. Intermedius is intermedius, right? But because they are vast, so we call it vastus lateralis, vastus medialis, vastus intermedius. And where are those muscles? 1, 2, 3. Easy. Vastus lateralis, vastus intermedius, and vastus medialis, right? No big logic. So easy. So easy. So just it is over there, right? One more muscle which we should learn at this point of time. Now there are so many small muscles, right? Not to worry, all those small muscles will be coming into picture, but at a correct time. One muscle which is again a very long muscle. This muscle, when you actually draw the thigh, right? It goes all the way like this cross. It crosses like this, right? This is the muscle which is called as the sartorius, right? The longest muscle, sartorius. So it starts all the way on the lateral aspect and then it goes all the way on to the medial side of the knee joint, right? All the way. So that's sartorius here. See that's chota sa attachment, right? That is sartorius. That is sartorius. Now, even if you remember these many muscles actually telling you have completed front of the thigh, almost you have completed, right? So much so. So, but say there are, you see, there are few muscles on the iliac crest. No, will not touch them right now because they are all the muscles, they are like strip muscles, so thin. So they are not giving us a good judgment, right? Let's see this. Now this is something which is giving us a very good clarity, right? If we identify these many muscles is more than enough. And one muscle without saying you will instantly name it. I don't have to even tell you which muscle it is. This yes, it is iliacus, right? So that is what you will never miss. The specialty of this iliacus is, see, it is crossing the hip joint. Here is the hip joint, right? It is the hip joint. So it is crossing the hip joint and then it is getting connected to the femur. So it means when this muscle would contract, can you expect what it will do? Right? This muscle, which is in front, powerful muscle, big muscle, it is landing on the femur. So when that muscle would contract, what it will do? Any guess? We'll see rectus femoris, everything we'll see. But just tell me one thing. Iliacus, right? Don't just apply simple basic logic. Don't go for any of the high end on things. Simple logic, right? Something which is connected on the hip bone and it is landing on the femur and right in front, right? When it will contract, obviously it will like flex, right? It will flex the hip joint, right? That's what you'll see. Okay. That's right. That's right. Right. Now you are getting it. Okay. Now see, there are two other important muscles, right, which are shown over here. I'll I'll tell you these muscles and then we'll go back to that previous figure, right? Because otherwise it would have made things bit more complicated. Now this is, as we said, that obturator foramen. So in obturator foramen, right, there is one area which is in front, one which is in back. Now front or back, it's a relative thing. So we'll say one which is external, one which is internal, because see, obturator foramen is like this, right? So something which is into the pelvis, we'll call it internus, and something which is out, so we'll call it externus. And friends, this one is obturator externus. Obturator externus. This is the external obturator. So there will be some internal. Yes, there will be. There will be. Okay. Now, one question. Say, that's the central axis, right? When things are moving away from the central axis, so we call it abduction, right? We call it abduction. It is going away. And when things are coming back, right? When it is coming back, we call it adductor, right? When the leg is getting added into the body, we call it adductor, right? So over here, if you see, what should happen when this muscle, which is connected on the medial surface, when it contracts, it will take the leg towards the body or it will take it away from the body. Obviously, right? It is connected on the medial side. As we contract, right, it will get it near the body. So this is adductor. adductor, but still there is something is to be written, right? We'll see. Let's go back to our previous figure, right? To get a good orientation, right? Now over here, as soon as you see this, and if I ask you a question that which muscle would be connected over here, beyond doubt you will say it is obturator externus, right? No problems, because that's the muscle which was going like this, right? How easy. Okay, so we'll call it obturator, obturator externus. Okay, yeah, I could have given the name directly, like, right, but then there is no point. There is no point, because when we try to say give the muscle that okay, it is adductor longus and brevis and magnus, brain gets confused, right? Unless you have studied it, so then you will say, yeah, it is so easy. But the unfortunate part is when we pass 10th standard, then and then 10th standard becomes easy. And then when we are into 11th standard, we say 10th standard, kare kya yaar tum log, it is just this much of course. Look at our course, right? So things are always easy when we clear it. Otherwise, till that point, even the exam of 5th standard was tough, 6th standard was tough, or everything was tough. But after you pass it, you feel, yeah, it was so easy, right? Okay. Now I'm about to tell you one muscle, and I don't have to tell you anything because you will always remember it. You will always remember it. And it is this small muscle. I would not have explained this muscle, but because I know its importance is so high, right, that invariably everyone remembers it. This muscle is called as the gracilis. It is a very graceful muscle, right? But its another name is honeymoon muscle. Now, this muscle's importance is tremendously high, right? When we'll see that muscle, this muscle that during intimate moments, it is the muscle which actually grips the partner. Now, this muscle, it is associated absolutely on the medial aspect. So that's the reason that this is so powerful, right? And it has got a very specific importance. Okay, we have not talked about this muscle over here, right? We have not talked about it. This muscle, if you can remember the name, well and good. If not, nothing to worry, because its name would come 10 times, 100 times again and again. Its name is pectineus, right? Its name is pectineus. But you are completely at liberty to forget this name, no problems. And when I say that, that you are at liberty to forget that name, you will always remember that name. Okay, so this part, this portion, that is, what do you think? Right? That is where that adductor was connected. See, correlated. Here it is, right? And here it is, right? So that's where that adductor, right? It is all connected. See, over here, over here, over here. Right? Now I'll zoom this thing for a bit of clarity, and I'm erasing this obturator externus because you know this, and I just want to give you some clarity on this. So I'm removing this also. Okay, that's right. That's right. That honeymoon palsy, that was in upper limb. Yeah. Okay. So coming back to this, okay, I'm just writing this, right? That is gracilis. Now, can you see zoom, and this portion? Now watch carefully. This portion. That is the portion which is adductor, adductor, and I'm adding the name brevis, brevis. This is a short muscle. So it means there has to be a long muscle. Yes, that long muscle will call as a longus. Okay. Because adduction is a very powerful movement, very important movement, right? Taking the legs in. So it is the brevis, which is a short muscle. So this is short. But we are giving the name brevis so because there would be a longus muscle. And then there is such a big area which is given over here. This is also adductor, right? It is magnificently big. So then why not to give it the name adductor magnus, right? So we have adductor magnus, adductor brevis, and adductor longus. Adductor longus, right now we are not watching, right? It will be into, it is into other portion, right? So we'll see that. So just compare this, that this brevis, brevis from here, precisely from here, that muscle is coming out. Do undo, and here it is. Now see, should not be a problem, right? This will immediately create the impression that yes, that's the attachment. That's the attachment for adductor brevis, right? You might ask the question that is this a small muscle? Is this a short muscle? Well, short and long, they are relative term. When we'll see magnum, right? Magnus. So that is so magnificent, right? Such huge muscle that yes, we will say that it is a big one. Longus, simply its length would say that it is a long muscle, right? So I'm just unzooming it. So now you will be able to appreciate. Okay. So this is how adductor brevis is now completely fine with us, right? Obturator externus, we should not be having any problem. And iliacus, 100%, right? And yes, this was which I told you. Don't remember, but I know you have remembered it. And that's why I'm writing it. And it is pectineus, right? So that is how we just look at it, right? Are pectineus. Yeah, now it's okay, right? And what about these 1, 2, and 3? You know that, right? All big, vast muscle. So they are vastus. So this is vastus lateralis, vastus intermedius, and the vastus medialis. Very easy. Okay. Now there is one typical muscle, right? A very typical muscle, the way it is arranged. This muscle over here, see the pattern, right? The way it is connected onto the sacrum. This is piriformis. Piriformis. The importance of piriformis, it would be so enormous, but it would be into the, when we'll be discussing the pelvis, right? At that point, it will come into picture, right? The way it forms the diaphragm, the way it has got so many functions, right? So that piriformis is a vital, very important. Okay. We have added some more muscles, right? And every muscle associated would be added with some reference, right? So we know this muscle, and that muscle is iliacus, something which we cannot forget. But this iliacus has always got a very good partner, and this partner is psoas, right? And this is psoas major, this one, right? That's the reason that many a times they both are collectively called as the iliopsoas, right? It is called as the iliopsoas, psoas. Collectively, it is called as the iliopsoas. But if there is major, so then there has to be minor. Otherwise, we could have called it just a psoas muscle. So this thin one, this thin muscle, can you just see, right? It is going like this, and it is going like this. This one, right? That is psoas minor. Right. So we have got psoas major, psoas minor, iliacus. That much is completely good. Okay. Yeah, Tanu, you are very right. In fact, I always used to say this thing that this is like a cartoon, right? I never wanted to say this thing, but when you have pointed out, yes, say I say these are the eyes, right? And this is the smiling face. I always feel like that this is a cartoon. Yes, that's right. Now see, now everyone will look like, yes, it is like a cartoon. I told this thing even in one of the Viva also. Okay. Now the muscle which you are not supposed to remember, and I know still you have remembered it, right? The muscle which was attached on this ridge, right? On this ridge. And I told you not to remember it, but still you guys are such, you remembered it, right? ठीक है, चलो. Now when you have remembered it, tell me the name. Right? It is, that's right, it is pectineus. Now, this pectineus is interestingly, it will be forming a floor of the femoral triangle, right? Floor of the femoral triangle. And this muscle, say this one, right? This one, that also you know, this is adductor brevis, right? Adductor brevis, the one which we said that it is a short muscle. That's the long muscle, right? This one. This one is adductor. It is adductor longus. Now we say that yes, this is really big as compared to adductor brevis. Now adductor magnus, adductor brevis and adductor longus, they are arranged one over the another. There is some overlap, right? So at this point of time, just see it like that this is adductor brevis, and then on top of it you have got some overlap, and then there is big one, that is adductor longus, right? Pectineus is over here, so that is pectineus. So you have got the pectineus, adductor brevis and the adductor longus, right? We are going from lateral to medial. And then how nice it is that when we say that the lateral most, there will be iliopsoas which will be crossing this area. Now see, it's not that complicated, right? These many muscles, if you have understood, it is like almost you have completed the anterior region, right? Just few things are to be added. Where is we cut abs muscle? Abs muscle, right now we have, say, not even, we are talking about these deep muscles, right? These are the deep muscles, because once these deep muscles are over, and then the all those superficial muscles will start coming up. So we are just picking up the things the way, first the bones, only the bones, raw bones, we know the parts of the bones, and then we understood few names of it, and then we are trying to add one by one muscles into it, so that we are constructing the entire lower limb, right? Because once we have constructed this, then learning hip joint would be so cool, so easy, because half of the things, so you'll be able to even visualize. you'll be able to say, yes, when this muscle would contract, definitely there'll be contraction, there'll be flexion. Yes, all these anterior muscles, they do what? They will be doing only one thing, and that is the flexion, right? So, but, and the names are suggesting adductor. So obviously, because if they are connected on the medial side, right? Yeah, Magnus is coming. Tushar, Magnus is coming, right? Magnus, it has got its magnificent entry, right? It is coming. So, so what I was telling, yeah. So adductor, when they are connected on the medial aspect, and then they are on the other side, they are also connecting to femur. So obviously it will pull back, right? Let's add something more to this, right? Step by step, we are just adding few muscles. Now over here, you will be able to identify certain muscles with clarity. Certain muscles, they are added new. Things which are already known to us, will write them in short, right? So for example, now for iliacus, is it okay? Just I write IL, iliacus, we know this. For psoas major, we just write PS, psoas. There is psoas minor, there is psoas major. This one is psoas major, correct? And this thin strip, this thin one, this one, that is minor. Okay, chalo, that is done. Then the muscle, I know you will never obey, right? Still you have remembered this name, right? That is pectineus. Okay. And then there was adductor brevis and adductor longus, right? So this niche chupa hua, that small muscle, that is adductor brevis, and then this big one, right? That big one is adductor longus. Adductor longus. Well, this muscle, right, which we should draw with pink, this one. See this muscle, it is the medial most muscle. And that gracious muscle is gracilis. It is gracilis. Very, very important muscle. Because it has got two important things. One, and it is okay to visualize, right? Because then you'll be able to remember it with more effect, right? The function of gracilis, why it is actually called as the honeymoon muscle. It has got two functions. One, what it does at hip joint. It is a very powerful adductor, right? So it induces adduction at hip joint. And second important thing is that it gives medial rotation of the thigh, right? This gives medial rotation of thigh. Now both these movements, they are of extreme importance in those intimate moments, right? So that's the function of gracilis. Let's move further to add a few more muscles. So I think most of the muscles, they are known to you now, right? So now I'll write it in still shorter, iliacus. This is psoas major. That one is psoas minor, right? This I'll not even write, right? Because I told you not to remember it, and still you have remembered it, right? So I'll just put smiley. Then this is adductor, that's right, brevis. And then this was adductor longus, that's right. This is gracilis. So only one muscle which is new in this, which is, we are watching it over here, right? Say this one, this one. Any idea that which muscle could it be and which muscle could this be. I'll just name it as 2 and 3, right, to give you some hint so that you don't make a mistake, right, because one was attached here which we have not yet put, right. So this one was what? All they were, right? They were vastus. So this one would be vastus lateralis, this one would be vastus intermedius, and this one would be vastus medialis. So easy, true. So that one is vastus because they are new. So let me write it down to avoid any confusion. Arre. So that one would be, let's not write lateralis, right? Because lateralis is not there at this point of time. So we just keep it like that. So this is vastus intermedius, medius, and that one would be vastus medialis. Good. Okay, let's add something more. I need not say anything. You yourself would immediately say that this one is, that's right, it would be vastus lateralis. Excellent, right? So then rest of them are vastus intermedius, vastus medialis, right? Then this one is that smiley, right, which you have remembered. Then this is adductor brevis. Then this is adductor longus. This one, though, I know you will always remember, right? And it is worth it. Gracilis. This one is sorry, Iliacus, and this is the Psoas brothers, right? Psoas major minor. Okay, here is one muscle, that muscle, right? Which I said that this is a very classy muscle. Yeah, this is a very classy muscle. Its importance would come when you'll be studying, sorry, when you'll be studying the pelvis. This is piriformis. Now for piriformis, I am just zooming it because I want you to have a very important concept in this. See, the piriformis, I'm drawing the piriformis with this red color. This is how the piriformis is going. From here, right, all the way here. From here, it is all the way here. That's the muscle. No doubt, it is on the back side, right? It is on the back side. But what you are watching over here, this portion, that is also piriformis. So when we'll be looking from the back, right, you should understand that piriformis is how the piriformis is actually spreading, right? Yeah, got it. So I'm drawing it like this, like this. Okay, so that's the piriformis. Now this small, very curvy, very nice muscle, this is the muscle from the gluteal region, buttocks. This is gluteal region and it is called as the gluteus. Gluteus. It is the deepest one, right? Smallest one. So minimus. It means there'll be some, those bigger muscles will also be coming. Yes, they'll be coming, right? So all clean. Rest of the muscles, they all are known to you, right? Vastus lateralis is there. You know this is vastus intermedius and you know it very well. This is vastus medialis, right? Okay. Yes, we are getting some extra new muscles in this, right? I think most of the muscles they are identified. You have identified. You know them, right? Very quickly we go for this is piriformis, right? Piriformis. And that's the Swas brothers, right? These are the Swas brothers, right? These are Swas brothers. This is the partner Iliacus, right? That one is gluteus minimus, gluteus minimus, and that now though I won't even draw this much. I'll draw it here only, right? And this one is adductor brevis, adductor longus, gracilis, and this big boss who is lying exactly on it, right? Who is covering this vastus, all vastus group. This vastus lateralis can be seen. He is rectus femoris, right? A straight muscle, straight away, going from all the way and it is going straight. So this one is the newcomer into this figure and he is rectus femoris. So that he's the only newcomer. Rest to them, they are all now known to us. Okay. Let's see if we get anyone new in this. Yes, we are getting 2, 3 muscles, right? One muscle which is all the way, right? And who is like what we were talking about, that's a thigh. So that's how it is going all the way, crossing it. And yes, you are right. That is sartorius. That is sartorius. This one is sartorius, right? One more, this, right? A very, very typical muscle because as it is proceeding, right, it is going towards this all thin fascia. This muscle is tensor fascia lata, right? Or latte, tensor fascia latte. So these are the two muscles. Otherwise, piriformis, pectineus, right? All those adductors, gracilis, right? And the psoas brothers and its partner Iliacus, all are known to you, right? This one is rectus femoris and this one is vastus lateralis. Done? Okay. We can study for some more time, no? Because it is exactly the halfway we have completed, right? Now the second half is about the blood vessels and the nerves. So we can do it either way. Either say if we stop, we have to stop at this point. Tomorrow you revise, you come with complete revision of all the muscles, and then we start putting the arteries and the nerves into that, and that would complete the whole picture. Right? That's what I was also feeling like, because over here right now, say after 15-20 minutes or half an hour, if we stop, we'll be stopping something in between, right? So let's stop at this point, right? And tomorrow we'll be completing this portion and then we'll be proceeding with the hip joint, right? So but I really enjoyed talking to you guys, right, after such a long time, right? So I really liked it. So thank you so much. Right? Do revise all these muscles properly, right? And tomorrow we'll be starting from this junction. Okay. All right. Huh. Arvind, I don't mind. I don't mind, but it happens like that. Say, I don't want to say once we'll start the artery, we'll start with common iliac and then all the way going to profunda femoris and the branches of profunda femoris, right? So in a single shot, you'll be knowing about all the arteries of the lower limb. Otherwise, over here it would happen that half of the things would be done today, half of the things would be tomorrow. So even in teaching also I'll be getting the interruption. Even in understanding also you might not get that flavor, right? So we'll meet tomorrow. There is no hurry, right? But this way, not only you'll be learning the anatomy faster, but it would be giving you a pleasure, right? You'll be able to actually identify. When I'll show you those dissected images, trust me, you'll be able to pick up every muscle. Okay, yes, this is this, because everything is connected, everything is integrated and associated, right? So thank you so much. And where is cloud folder? Cloud folder, I'll put a link in that. Otherwise, it is the same link which was over there into the previous sessions. Same link, but doesn't matter. I'll put that link again for the benefit of everyone. All right. So thank you so much and see you tomorrow. Okay. Bye bye.